the importance of smoke-free public places. That as we continue to advocate, we should always make sure that we have environments that are smoke-free, but also recognizing the important or integral component of human rights, that it's also a human rights issue as well. This morning, as we were looking at the slide, we debated on it a little bit with my team, and my team actually came to the conclusion that this was a relationship. I didn't, by the way, believe that there was any. I just thought it was too interesting. Two parties, and one is concerned, I want to smoke, and the other one is saying that it's also my right not to be in the presence of smoke. But they came up with innovative ideas. So just the power of a picture. The power of a picture, you can tell so many stories. So one of my team members, I don't know whether it was the lawyer or the rabbi, one of them said, it's a relationship here, and one of them is, wants to smoke, and the other one saying, but we're in a relationship, and if you smoke and do that, you're also going to, I'm going to die, and that's the interpretation. But I think generally it's just about saying that, there's of course the concept of that it's my right to do what I want to do, but then there's the other aspect as well about the consequences of this particular right that you have. And so it always boils down to the issue of responsibilities. What are my responsibilities as an individual? And I'm surely not going to bore you, because I think you're all advocates in this room here and experts, and you know the impact of, and I'm sure you've been taken through this the whole day, that there's enough scientific evidence to show what exposure to secondhand smoke does. So I'm just going to rush through these slides, because I think I'm actually talking to the converted. I think you're converted. You know what the effects of smoke do or does. What smoke does to those that actually inhale the product, the tobacco, whatever it is that you're smoking, but also those that actually exhale the smoke itself, and so this passive smoke or secondhand smoke that we talk about. And there's definitions about what we mean by smoke. But I think what is even more, but why this emphasis? Why are we so concerned about this? As far as what's the big deal? Well, the big deal is that the smoke itself produces a number of chemicals, and look at this number. It's shocking. It's alarming. I shouldn't say a number. I said a huge amount of different chemicals, and also a huge amount of toxins, also including carbon monoxide. And you all know about the effects of carbon monoxide. And so that's why we're worried about the product of this product itself, or this dangerous substance. And it's because of that there is actually a number of documentation that is out there already that talks about the problem. Now, why are we so concerned about it? And I think the most important one, or the one that is most known, is this one here. That is the Framework Convention on Tobacco Control. That is actually the first public health treaty that was ever signed, recognizing the problem that we have in tobacco. And I'm sure you all have that document with you, and you know what it talks about on Article 8, that talks about the scientific evidence and what is expected of parties. And then again, the issue of secondhand smoke, because I think, and I think these slides, by the way, I should also confess that these are not my slides. I'm just using what has been presented, prepared and done, and so I'm just talking to them. But I think the whole purpose here also is about the fact that, and I think it's also addressing the myth that, sometimes the belief is that when you're exposed to an environment for a much longer period, that's when the harm is. But unfortunately, with tobacco, with secondhand smoke, that's not the issue. The issue is that it doesn't require you to have been exposed for years. It can take as much as just 30 minutes, just an hour, and that already there are physiological processes that are taking place in the body, and so forth. And so here it's just talking about the way in which the blood will flow, and the issues of increased risks of heart attack and stroke because of clotting because of course when the changes in the flow of the blood, there are also incidents of where clotting comes in, and that of course brings in the risk of heart attack and stroke. And then again, I think what is even more alarming for me was the last bullet, where it talks about 10% of, it caused about 10% of tobacco-related deaths in secondhand smoke. And so that in itself, So these figures are meant to actually create stimulate that thought process that there's a lot that needs to be looked into when we talk about tobacco and exposure to tobacco, to smoke itself. And again, this one is really just talking to what I've said earlier, that there is no safe level. That once you're exposed to tobacco, you are putting yourself at risk. And that is why we're so concerned about the passive smoking. That this is someone who has chosen not to smoke, and then is then exposed to this harmful product because of someone else's behavior. And so that is why we have to continue advocating for those that make a choice that they're not going to smoke. But then, of course, how do we make sure that they're protected from that smoke by the second-hand smoke issues? But again, even those that do decide to smoke, how do we make sure that we provide sufficient public health education to make sure that they recognize the dangers of smoking? And so this slide really talks to those aspects as well about tobacco smoke as well. And then again, what is also of concern to ourselves as public health experts is the effects that this smoke has on children. And again, we've listed those there. On the pregnant woman, and of course, again, the unborn child who also didn't ask for this, and of course has also got human rights. This unborn fetus, and then the child itself does have, we also have a right and responsibility as public health experts to make sure that we also prevent unnecessary effects as a result of exposure to secondhand smoke. And so those have been listed there as well. The other one is the issue about the workplace, that we also know that many of us have to work, but it's also our responsibility to make sure that when people are placed in the workplaces, they are also protected. And that is the role as the Ministry of Health, is to also make sure that we have necessary instruments and also necessary measures in place to make sure that we also protect the rights of workers in as far as health, mobility, and mortality is concerned. And these are also listed here as well. And this slide really talks to the issues about the one of the major areas of risk, and that is in the restaurant, bar, and casino. And I'm sure you've seen that as well. That this poor waiter or waitress, let me say waitress, this poor waitress who has to keep on coming. So she keeps on coming into this restaurant to serve us, and yet we are smoking. And she doesn't smoke, and so of course they also become at risk because of the exposure to the secondhand smoke. And that it's also a little bit deceptive when we start talking about these barriers that are within these areas, assuming that it creates a false alarm. In essence, I think we mislead people by creating a false alarm that you're actually protecting, but really, you essentially just this bar. It's still smoke. I don't know. I kind of forgot how long it stays, but there is data to tell us that it stays for quite a long period. When you've smoked, the smoke itself remains in the air for quite, is it?
In the air, it stays for about 24 hours, yes. But it clings to curtains, the ceiling, and that can be there for months afterwards. They call it third-hand smoke now.
Yes. Third-hand smoke, even more dangerous now. So you can see that it becomes even more complicated. That it then actually stays onto the clothing that you're wearing, and so you can't actually leave it. You can leave the room and leave the curtains, but you can't leave the clothing that you're wearing. So it becomes. So we have these bars and casinos that also are about 3 to 6 times as high, and that the different food service workers have 50% higher chances, rates of lung cancer than the general population, and so forth. And this is not data that we're just making up. This is scientific data that has come, for example, this one is coming from the UN Surgeon General's National, the Council itself. So these are some of the issues that we need to continuously be working on as health professionals to make sure that we protect those that choose to work in such industries, to make sure that they also are protected And also those even that smoke themselves, we should also protect them as well. This one is really talking about the issue of smoking as a human rights issue, because of course we've heard that, and we've heard the tobacco industry also say, pushing this agenda as well, that this is a human right and I can choose when to smoke, how many, where, and so forth and so forth. But of course, I guess we also come in from the perspective about the responsibility that we always have to sort of zero in as well. But also, we also talk about the right to health, but also making sure that you are not compromising on your own basic health as well. I mean, as the human rights itself. So this one here really talks about the right, I'm mixing the slide, but the right to health, where it's the Universal Declaration of Human Rights of 1948 that talks about this aspect where everyone has a right to a standard of living adequate for the health and well-being of himself and his family. And I think that's key as we continue to sort of dialogue with the tobacco industry about the human rights issues, that it's also about those non-smokers as well that have a human right as well, a right to a certain standard of living. And again, this talks about the smoke-free environments to protect health, and all people have a fundamental right to breathe clean air, completely smoke-free, indoor environments with no exceptions, are the only proven way to protect people. And that 100% smoke-free environments require the elimination of all smoking and tobacco smoke indoors. And I think that's an important bullet as well, that if we are to sort of address this, we need to have a 100% smoke-free environment. So this, of course, touches in on the issue of legislation, that we need to make sure that our legislation makes sure that the 100% smoke-free environments are there as well. And I'm sure many of you will have probably recognized that that was one of the current limitations with the current tobacco, it's the Control of Smoking Act of 2004. That you've probably, and I'm sure you've taken through that's one of the gaps that we've also recognized there as well. And that even ventilation, which has been this thinking that you have air cons and fans, and you have open windows, or you have this segregation of rooms and so forth, it just doesn't work, because of course there are those secondary, and now also the third level as well. And I think this was just zeroing into the fact that even within our own constitution here in our beloved country, we also recognize the protection of the right to life. And that is the very essence of why we need to continuously make sure that we provide a conducive environment that does that. And I think I've talked about this aspect about the Framework Convention, that the preamble also talks about the priority to the right to protect public health. And I think this is just, and these slides are just talking about the emphasis or the importance of legislation. Because of course you need to also have good legislation to be able to actually enforce some of these scientific thinkings. Otherwise, you're not going to be able to succeed. And we recognize that, I think, with the current ones. And so we need to make sure that we meet the obligations of the Public Health Treaty that we've talked about as well, and make protection universal. And this is really talking about the indoor public places, the indoor workplaces, including vehicles used as places of work, all public transports and so forth. It was actually interesting. We had another conversation again with my team this morning, that it's quite interesting that even the vendors, those that sell tobacco, that sell this the cigarettes, you'll find that they don't actually want you to smoke next to them. And then they take you far away and say, go and smoke elsewhere. So even for themselves who are selling it, they recognize that there's a problem there. So so we need to continuously make sure that we actually avoid such kind of scenarios where you have to then sort of be faced with tobacco. And sometimes, of course, this vendor, some of them will listen, but there are sometimes when people actually refuse and say, no, I'm not going to move, I'm going to smoke here. There's absolutely no reason why I have to move from this place here to go and smoke, and so forth. So that's why we need to continuously be emphasizing and enforcing the right to 100% smoke-free public places. Because of course everybody wants to go out, everybody wants to be able to go out and enjoy and have a good social life, but it shouldn't compromise on our own health. And that's why we need to make sure that we have good legislation to make sure that those that decide that they want to go out shouldn't actually now be putting themselves at risk by going out. And that's the indoor public places, But even then also, those that want to, that work, we should also be making sure that we have appropriate legislation such that it doesn't compromise them going to work as well, and so forth. And so I think the general gist here is that there's enough scientific evidence that shows that smoke is harmful, and that we also have an obligation to make sure that we protect, as a ministry, together with our partners, protect human lives. And that's why we have to go all out to make sure that we implement those issues. And then, of course, these are the stories about the rights to smokers, and that they argue about the individual choice, and we shouldn't allow, we shouldn't dictate when and where people should smoke. This is the usual counter messaging that comes out, and when the industry decides that they also need to be able to get a lot more people on their side. And so we also need a lot more work that needs to be done on our side as well. And I guess the bottom line is that we need to be vigilant as tobacco control advocates for protection of health. I think we shouldn't hide it, and we shouldn't be shy of actually being advocates for health, because particularly when we know that it's a harmful product. And I always give an example also here about, I'm terrified of snakes. And so why would I want to go into a room when I know there's a snake there? Why would I want to be bitten when I know the implications of going to this room and being bitten? And so why would I also want to go into a room full of smoke when I know the implications of actually exposing myself to such smoke? So it's also about, I think, personal responsibility, that we also need to take personal responsibility as individuals. And I've talked about legislation, of course, because legislation is key, but also there's also this aspect about recognizing that we also have responsibilities as individuals to make sure that we also take appropriate what do you call it? Or maybe appropriate behaviors that don't expose us to risks as well. And I think what is alarming here in this particular slide is that, and just to share with yourselves, is that it becomes very alarming when you look at statistics and you look and say, but if we know the dangers of smoking, why are we still having such a huge number of people that still smoke? 18%, I think, is quite high, or current smokers of tobacco. This is the statistics for here. And then those that use smokeless tobacco, about 6%, of women do that, and that's also alarming, I thought, when I looked at these statistics as well. But the one that we have been doing also, the STEP survey in the ministry, also shows us that about 28% of adults are exposed to tobacco smoke at the workplace, which is also alarming, particularly when we say that we shouldn't be having employees being exposed to an environment that is unhealthy for them, but more specifically when we also know that they become more at risk. And that also 43%, even more alarming, were exposed to tobacco smoke at home. So you can imagine those poor children that cannot tell their dad or their parents to stop smoking or go outside and smoke. And, well, there's some that are brave to do that, but some don't. But again, these are the poor kids children, people who don't have voices, the unheard ones, that also have to be exposed to this. And I think that's why we need legislation to be able to enforce, to help us move in that direction. So where are we now? I think we've heard about this as well this morning. Is that we've been working on amending the control of smoking, which was not amending, of sort of repealing this act and actually coming up with a new act. Have you? I don't know whether you've been told the new name as well or not yet. Not yet.
Not yet.
Okay. So the process is that we are working now on repealing this one here and coming up with a new act. A new act will address some of the frustrations that I've highlighted earlier. Exposures in these public places, and how do we then align the old one to this one here, recognizing there are certain articles in this one here that we also need to articulate a lot more, and other areas as well. And so those are eloquently alluded to in the proposed act. It's an interesting act because I think it's been out there for a number of years being revised. So each year, as new things come out, it's being amended. But of course, we need to stop at one stage. So we think we're at the tail end. We think we're at the tail end, and hopefully, in the coming weeks, you should be hearing something very positive in as far as the new legislation is. And so we believe that we are finally there, and quite excited to be there, and we've worked extensively with our partners. We are also grateful for the support that has been provided. So that's where we are with the current debate. But I think the thinking now is really to move towards a smoke-free public places, because it's everybody's right.